All right. Hello, everyone. Looks like we're live. This is my first, believe it or not, this is my first Facebook Live ever. So I'm very excited to be joining you guys today. We're going to be talking about a whole array of different things, including cannabis, Zana Medical, medical conditions, and how it relates to cannabis, all types of fun stuff. Let me give you a little bit of background first, tell you a little bit about myself and about Zana Medical, ask any questions along the way, and I'll kind of manage those and try to answer them. Yeah, let's get started. Trying to see who's on here, but we'll just keep on going. So first I want to talk to you a little bit about just what Zana Medical is, since you're here on the page, and give you a sense of how we came to be and why we exist, really. I mean, so Zana Medical it's a healthcare guidance company. We're here in San Francisco. I'm at our headquarters right now. But we have people throughout the world as well to be our care providers for people in different areas. And what we provide is powerful online healthcare guidance programs, as well as ongoing care services related to the clinical use of cannabis for chronic conditions. So we're a healthcare company and kind of emphasize the care component of it. We really believe in human relation and care over time, but we're also a technology-centric company to be able to really serve a larger number of people in an extremely affordable way. And so that's why we use technology, because we serve people that can't make it into a clinic. There's also some clinics that we see patients at. But also, in terms of chronic care, we just believe that more frequent, affordable, of course, contact between care provider and patients when you're dealing with a chronic condition is really the way to go. So there's a lot of support, guidance, and contact, and we believe that value, that's how you create really a valuable relationship where you can look at what's happening and really change it over time. My background, just before we kind of dive deeper, I helped co-found Zana Medical. I ran a cannabis-centric healthcare practice for about 10 years here in California. It was the largest practice in the world, actually, providing medical recommendations. And at the time when it started, that was really all that was being done, was just kind of cannabis recommendations. There wasn't a whole lot of cannabis-oriented care. And so we learned through seeing a few 100,000 patients, actually, here on the West Coast, a lot about how cannabis works in medicine, in the body, and how it needs to be individualized for each patient, really. Obviously, we navigated a lot of legal structures over the past 15 years here in California as well, and we're happy to say that we're really in the next wave of cannabis care, and we're on the tip of that spear. So I'm really proud of Zana Medical, and proud that we're getting to the point in the industry where we're able to actually fold this into a healthcare environment really kind of confidently. And that kind of brings me to why Zana Medical exists, and what my experience has been over the past 15 years in healthcare. And as you all may know, there's really a kind of epidemic of chronic conditions within the United States and within the world, actually a lot outside the United States as well. And everything from diabetes to chronic pain to fibromyalgia, it's really skyrocketing. And that, combined with the shortcomings of the institutional healthcare system to meet chronic conditions in a way that's really effective. What we're interested in is effective medicine. The Western system is really geared towards procedures and does extremely well, but it's a little bit of a triage-oriented system where people kind of come in and deal with their symptoms, and then they're so with chronic conditions, there really needs to be a little bit more of an ecosystem of care, looking at life, looking at and a natural way to do that. And The other reason, aside from the chronic conditions and the healthcare system, is that, we really are looking to provide a natural way to deal with chronic conditions. Pharmaceuticals are wonderful for certain uses, generally not so useful to take in the medium to long term. And so how do you deal with that? You can kind of, as an adjunct, use natural solutions as well as lifestyle and behavior change. And and we're just starting now as Zana Medical, if you're just joining us, because the research is to a point where we're now really able to confidently address chronic conditions in a way that's really effective with the research that we have. And this discovery of the endocannabinoid system, for those that you don't know, that's our internal, endo means internal, and it's called the endocannabinoid because it was discovered partially as a result of the discovery of the cannabinoids within THC. It was only discovered in the 90s, and it's only now starting to be really kind of studied by clinicians and by physicians from the beginning. They have a few of the first courses in medical schools in the States and outside. And so there's a kind of a wave of research and study that's happened over the past 5 to 10 years that's really starting to gain momentum. And we're a place where we centralize a lot of the answers and the research that's been done for specific conditions and generally with cannabis and cannabinoids, and we are able to serve that kind of in an accessible way on a platter to patients and guide them throughout their use. In general, with the shortcomings of the healthcare system and just how chronic conditions are related to, we at Zana we're a relationship company. We use technology to scale those relationships, but really it's about the relationship, because that's how people really are able to deal with chronic conditions over time and really be supported by their care provider, more frequent points of contact. All right, what cannabis and health conditions, cannabis and chronic conditions, how does that work? Not all cannabis is created equally, and there's a lot of confusion around that within the world, and that's why we're here to help clarify and simplify. We don't classify cannabis between sativa, indica, and hybrid. Why? Because it doesn't actually mean much scientifically these days. And so we help classify cannabis and how it relates to specific medical conditions, what's useful for a specific condition and a specific person, and what's potentially not useful. This starts with individualized intake methods or delivery methods. That's actually not discussed as much as it should be, in our opinion. And that's, inhalation, which includes smoking and vaporization, edibles, that includes capsules and also other foods. Most folks have seen foods. Topicals, which are put over your skin, right? And then sublinguals also, which go on your mucosal layer in your mouth. And all of those they impact your body in different ways, and therefore they impact your symptoms. If you're dealing with chronic pain, and you want immediate relief for an acute symptom, you want to use maybe inhalation. If you want prolonged, but even if you have the same thing, chronic pain, you want prolonged relief, maybe an edible because it lasts longer. So the onset time of an intake method, delivery method, and the time it lasts are extremely important factors that are totally separate from the strain or the type of cannabis that you're actually using. So that's a great starting point for really looking at the individualized use of cannabis. Then obviously stepping up to, great, what medicine can we use? That's another question that we answer after determining the intake method. There's not a whole lot of regulation in terms of the production of cannabis within California and really within the world. More in other areas, actually, in other states, within the United States and other countries, there's much more regulation than there is in California. It's been a little bit of the Wild West, even though the quality of the medicine and the standardization of that medicine over time has gotten better. There's not a whole lot of reliable sources. So we direct folks to cannabis medicine providers that are all tested. Safety, obviously, as a healthcare provider, is top priority, and it's not always easy to know where to get safe medicine. So that's just a baseline. What to use for a specific condition, there's different ratios. We call those cannabinoid ratios. So THC to CBD, or THCA, CBDA, maybe some CBN. There's different cannabinoids that make up this plant. It's a very wonderfully complex plant. It's kind of a medicine box, so to speak. But how do you sort through that? And clinical research, as well as evidence with patients, is what we use to apply a specific cannabinoid ratio. And there's terpenes as well. Terpenes are really what are in essential oils and in plants. Those generally can bind to your receptors within your endocannabinoid system as well, but they also affect your mood. And as we know, through your mood can, first of all, you can have conditions that are mood oriented, but also just how you feel can affect your chronic condition, right? So there's those things. And then there's obviously dosing. And again, there's not a whole lot of regulation, although it's improving. And so dosing is a huge issue after deciding what the intake method is, what your cannabinoid ratio is, optimal for your condition, terpene profile, and then great, where do I start as far as dosing goes? Huge, especially for folks that are cannabis naive, so to speak, who are just starting to use cannabis therapeutically. Very relevant, extremely important question, no matter what you're taking. Where to start, how to dose that practically. If you have a tincture and a bottle, how much am I actually taking within this bottle? How many drops should I take? How many droppers? How do I track that? What's working? All that fun stuff. Not in a simple equation, but we make it simple for you because we do that work. And so that's part of the guidance that we provide, is the practical support around cannabis, the clinical support around what to take, and then obviously the relationship support, one-on-one, just to answer any questions that arise along the way. It's largely what we do. And obviously, as I've mentioned, personalization can't state that enough. All of our endocannabinoid systems are different. Our density, a concentration of receptors within our body varies. We have a large concentration of receptors in our brain. And so psychoactivity can actually vary a lot between people, and that's one of the things that we deal with cannabis, is psychoactivity from THC. But also other organs have different concentrations, so we have to see how sensitive a person is, but also from a clinical standpoint, what cannabinoid ratio and terpene profile and intake method according to how the symptoms are arising, what might be appropriate. So personalization is really our mantra, if you could say it like that. And we want to get to know you, minimal investment from you, and we just really want to step into your world and understand what's happening, help you as best we can in a natural way. And again, the great thing about cannabis is you can start at a low dose, still have it be effective, and there's a very low risk of harmful side effects. And that's not always the case with pharmaceutical medications. So the wonderful thing about it is it can be highly effective. There's a very low risk profile with this medication, with cannabis. And so we see a lot of patients substituting other medications. Not only can they get better results a lot of the time, but also just reducing those side effects, whether it's anything from addiction to opiates, or even liver and kidney damage from using those over time for chronic pain, to all types of other conditions and of medications and interactions between those medications. So we call that a harm reductive approach to medicine. Reduces any harm that another modality or medication or approach is going to have for your body. We started with, so our main program is a sleep program. We call it an insomnia program. It's really to help you sleep. And it's just such a widespread issue across conditions and just in the world in general, whether you have pain and you can't sleep, or you're just a busy mother or a busy professional in your life. It's really hard to calm and actually get the space to do that. It can be caused from physiological reasons. And the reason we started with sleep is, one, because healing does start with sleep for anything. If your body can get an optimal amount of sleep, or at least more sleep than you're getting now, if you're not getting enough, your body can naturally start to heal itself and give you more. It's sleep. With increased sleep, you have more cognitive ability, and this is all proven. You have more physical energy, obviously, and you actually have more emotional balance throughout your day because you're less irritable, and it can provide a real foundation of a ground for dealing with your condition, both in terms of your symptoms, but just also in terms of how you're feeling about it. So sleep has a real, tangible, physiological, and cognitive impact on chronic conditions. Great place to start if you're having trouble sleeping is get that improved. And we've seen with basically everyone we've worked with, that sleep is a great place to start. So that's why we started with our sleep program. And yeah, it's for many reasons, people come to us for the sleep program. And what we've done is we've created an online program, and it walks you through everything that you need to know about cannabis. And it's for people that are cannabis naive and people that have used cannabis historically, whether you haven't used it for a few decades or you use it on a daily basis. Really, the program is geared towards everyone. It's customizable. It's all personalized. So you may not be using cannabis, if you use it now, therapeutically for your purpose. A lot of that information is not very accessible, so we try to make that accessible. Or if you haven't used cannabis, you're really going to want some guidance in this area because your starting point really determines a lot of the success that you'll have. We have patients that have used cannabis daily or experimented for years and then come to us and had success, had a few more hours of sleep per night very shortly, within a few days. We have folks who are cannabis naive and we're just afraid to embrace cannabis as a potential solution because of the psychoactive component. It's easily dealt with if you know what you're doing, where to start, what medicine to take. And so we've really made those resources accessible and transparent to everyone. So there's our program, and then on top of the program is a dedicated care coordinator. You have someone that's really dedicated to you and your condition, your journey with using cannabis therapeutically and in a healthy way, so that you can feel confident, no fear, and really lean into it, and embrace a natural solution that works. So that's why we've started with sleep. You can check that program out at zanamedical.com. We have a bunch of free resources as well. I just wanted to share with you today. We have a public resource that's all free and very comprehensive for many conditions. It's called Zana Health Lab, zanahealthlab.com, and it consolidates and centralizes a lot of the clinical research that's been done, but also a lot of practical tips around how to dose cannabis, how to use it for PTSD or chronic pain or insomnia or fibromyalgia. And we work with a very diverse population. Just so happens that most of our patients are either seniors or women or folks dealing with trauma. So that's largely our patient population. There's a lot of free resources on Zana Health Lab. Go and check it out. We have a wonderful podcast. It's an Anthology 5 series, and it's focused on insomnia, but it really gives a huge kind of depth of insight into how to use cannabis therapeutically. And you can look at the individual episodes. There's 3 episodes dedicated to specific segments. So there's an episode dedicated to women and cannabis and insomnia, seniors, and then veterans. Really, really valuable free resource, very engaging. Go ahead and listen to the podcast there. And it's a great way to get started and get acquainted with the conversation around what's happening, the legal barriers, dosing, stigmas, how to deal with that. A lot of those subjects are addressed, and we have case studies of patients as well as interviewed top-of-mind experts in the world that appear on both of those people, experts and patients, appear on the podcast. So you can really get a sense of what's working for people, where the research is, where it is at the moment in the world. There's articles on Health Lab, our podcast articles. There's very short videos that are instructional videos called our Cannabites that you can see there, explaining to you really practical information about how to use cannabis effectively. And then obviously go ahead and like our Facebook page. We've created another group just for discussion. It's called Healthy Cannabis. Check that out on our Facebook Healthy Cannabis group, or like our Facebook page. And it's been a blast. Thank you for joining me on this Facebook Live. It's my first Facebook Live. Thrilled. And we will continue serving patients. We're here to serve and push forward this field of cannabis medicine. Make it as clinical and supportive both as possible. We're bringing the science forward and bringing a new kind of model of chronic care management. So we look forward to supporting you in both those things, figuring out what to use for cannabis, what's right for your personal symptoms and condition, how to do that safely, confidently, and effectively, and then managing your chronic condition in other ways as well. We work on behavior change over time, gradually looking at your diet and exercise, looking at your social support, also looking at your environmental factors to try to get you some relief with cannabis, and then also go in a little bit to the causality of what's going on for your condition and why it arises in the first place, and how you can address some of those root causes a little bit to not only use medication, but also really provide a supportive ecosystem for yourself in your life. We're here. Thanks for joining me. Have a wonderful rest of the day, wonderful Friday and a weekend. Enjoy the summer. See you next time.